initiative.
Welcome back. This week is nationally recognized as Women's Blood Pressure Awareness Week, and our next guests are committed to underscoring the importance of this issue. Welcome, Luann and Tom from the Buffalo Prenatal Perinatal Network. Thank you so much for coming in today.
Thank you.
Let's talk first about why women's blood pressure is such an important topic to discuss.
Yeah, I think first and foremost, uncontrolled blood pressure, uncontrolled cardiovascular disease is the silent killer, right? So stats, 1 in 3 adults, so 3 of us sitting at this table with high blood pressure don't know they have it. So one of us at this table wouldn't know that we had that problem. About half of adult women have some sort of cardiovascular disease. And speaking about pregnant women specifically, about 10% of them have some sort of cardiovascular complication, hypertension issues, things like that. So I think there's a big disparity with cardiovascular disease and blood pressure, specifically when you're talking about women, that type of population. When you're talking about other underserved populations, there's great health equity disparities that exist.
Luann, can you tell us about what the BPPN is doing to recognize this?
Sure, in the past we've talked to you about maternal mortality and the fact that Black women are 4 to 5 times higher to have mortality issues. And actually, the New York State Department of Health report for maternal deaths, cardiovascular is one of the top 5 reasons. So we had started about a year ago with some funding from the James Cummings Foundation to buy blood pressure cuffs, the portable ones. And we gave them to our moms in the last trimester of pregnancy or if they were 8 weeks postpartum, because those are kind of the key times. Actually, a lot happens after, like the 42 days after. And we give them a log sheet. We tell them what's normal. And then they know when to call their provider. So we've had some instances already where, women had some issues with their blood pressure and they either called their case manager and then we would advise them to call their provider. So it's really important to us.
And you guys brought this in to show us how easy it is. So do I need to roll up my sleeve?
No, you're okay.
Okay.
Just put your hand in.
Okay. Now, you talked about that James H. Cummings Foundation and the initiative you started through that. So tell us a little bit more about what the mission really is.
So James Cummings Foundation they've funded other things for us. And they were very impressed with the idea of us being proactive about trying to capture the pressures before it became an issue. And then with the American Heart Association initiative, which, Tom can talk about, we got involved with that.
Yeah, tell us more about that.
Yeah, so thanks to some big support from CVS Health, we've been able to work with BPPN, 4 other CBOs, community-based organizations in the city of Buffalo, and 4 healthcare organizations in the city of Buffalo to try to increase education and collaboration along that patient-to-provider journey, and really focused on high-risk populations and focusing on access to quality care. We talked about those disparities, and a lot of those disparities exist. There's barriers related to transportation, language, awareness, and the CVS Health initiative, which is called the Equity Focused Hypertension Initiative, brings some of these blood pressure tools into community. It's meeting people where they are, to take their blood pressure, to see what their numbers are, and to refer them to clinical care if necessary.
I'm not making a comment, Chelsea.
Oh my God, okay, every time I do this on TV, I promise I'm fine, you guys.
I think you have white coat syndrome.
I'm fine, I promise I'm okay, and I've talked to my doctors about why sometimes I have high blood pressure. But you guys are trying to do a really great thing, which is giving people the resources to make sure they're staying healthy and give them access to what happens if there's something that's not right. So thank you so much for coming in and sharing more. Viewers, if you would like to learn more about the National Women's Blood Pressure Awareness Week, visit womenshealth.gov/NWBPAW. Thank you so much for coming in, you two.
Thank you.